Okay, I think we're just about at 12:16, and we may have a few people continuing to join us, but I think we can go ahead and get started. Thank you all for coming today to the meeting of the DCYF Oversight Board. I'm Diane Levy. I'm one of the co-chairs. Senator Wilson, who is the usual other co-chair, is busy today with session and is unable to make it to the meeting. We sure appreciate all of her hard work and all of the hard work from you legislators this time of year. And so I'm going to try and do this on my own with the help of Lisha and Nicholas, and we'll see how that goes. But before we begin with the update from our Juvenile Rehabilitation Outcomes Subcommittee, I'm going to turn it over to Lisha for the roll call and the approval of the February 21 minutes.
Great. Thank you, Diane. Good morning, everyone, and good morning to our board members and members of the public who are in on the call. So board members, for roll call, please unmute yourself and let me know you're here when I call your name. Anna Armstrong.
I'm here.
Welcome. And then we know Representative Steve Berquist, I believe, is absent. Katie Byron, I believe, is absent. Bobby Bridge. Senator Christian will be about 45 minutes late. Representative Tom Dent. Dr. Ben DeHaan.
Present.
Good morning. Dr. Marion Harris.
Here.
Good morning. Pamela Javier.
Good morning, present.
Good morning. Danielle Johnson.
Present.
Welcome. Ruth Kagi.
Present.
Co-chair Diane Levy.
Present.
Thank you. Lois Martin.
Present.
Good morning. Mary Spruce Garlant.
Here.
Hello. And then April Messenger is not able to attend. And then as Dr. Levy said, Senator Claire Wilson is unable to attend. And I do believe we have 8 people present. So we have 9. So we are at quorum, which is great. So next, I'd like to request that the board consider approval of the February 21st, 2025 meeting minutes. Does anyone have any feedback or edits to these minutes? Okay. Is there a motion to approve these minutes?
I'll motion to approve.
Thank you. Would anyone like to second?
Second.
Thank you. Let's vote on this. So all in favor, say aye.
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 Great, thank you. With that, the minutes are approved.
Excuse me, Lisha, this is Lois. I'll abstain since I wasn't present.
Oh, thank you for saying that, Lois. I'll make a note of that. Do we have any other abstentions? Okay. So Diane, I'm going to turn it back over to you.
Okay, thank you, Lisha. With that completed now, we're actually going to turn it over. Oh, is Bobby here? Because I know she wasn't in the roll call. I don't see her. Nicholas, is she?
She just emailed me. She needed the link, so I just sent it to her.
Okay. So we can maybe pause for just a second, and then she's going to update us on the Juvenile Rehabilitation Outcomes Subcommittee and what they've been doing, which is at this point I'm part of that subcommittee, because I can just say that we've had 2 meetings, and then hope that she gives you more detail about the substance. They've been very interesting thus far. Lisha, do you think we should just wait for her, right?
Since our presenters are coming at 9:30, I think we just maybe give it 1 or 2 more minutes, so she's able to get on. I don't want to steal her thunder, but I can share that we've had DCYF present at each meeting just to kind of give us a sense of the landscape of JR right now, and that has been particularly useful, especially to have an opportunity to have back and forth questions. Oh, and Bobby is here. Wonderful. Welcome.
Nothing like coming in, Bobby, and being immediately on the hot seat. Welcome. And now you can present on the
Thank
Juvenile
you.
Rehabilitation Outcomes Subcommittee.
It did say 9:25, but I thought, of course, smart aleck me, that I had the link and it was going to work, and I didn't. But anyway, thanks so much. Just quickly, because I know we've got rules of things on the agenda. Thanks to all of you, and particular thanks to our Merry Band from the subcommittee on JR outcomes, Danielle. Is that how I pronounce your name, Danielle? Am I good? Okay.
Yeah, you're good.
Danielle, Pam, and me. We have been directed to review and analyze the data measurements that are the data that's being collected and the measurements that are being made to determine success in JR. Some concerns were raised about a year ago by me and others, quite frankly. And then at the time when we prepared our report for last year to the legislature and to the governor about, are we really measuring the right things? I mean, recidivism is there, but aren't there other things that we could be looking at? And also to take a look at that, because perhaps that data is not available, and there's all kinds of potential answers to what's happening. And so what we want to do is get it right and help the department measure what needs to be measured, and help them prove that the actions that they are taking are in fact working for our kids. So we've had 2 meetings and 3 more to go. At the end of those 3 meetings, 3 additional meetings, and potentially beforehand, I think all the members would like it to be beforehand, including me, we will make some findings, if you will, and recommendations for action. And that will be an action plan, but we will present it to this board for conversation and approval before we carry on. So the first couple of meetings, we were in the exploratory study learn phase. And the first, we had a briefing by Jenny Hedden, who's the assistant secretary in the JR realm, who provided the information on the data that they have, and why basically they determine the metrics that they did, how that's been going, where they see gaps and would really like to have improvement. Some of it may come from identification of really where the data is, because nobody quite knows if it is anywhere. I guess, that's another thing, of course. But anyway, it was a great conversation, very robust, and we had an opportunity to ask a lot of questions from Jenny, because our Merry Band comes to this work from different levels of experience. One of the things that we learned, of course, that day is that we're not the only game in town, and that there are other entities inside government, let alone outside of government, who are looking at JR and what it is doing and what it should do. What kind of data are they collecting? Who are they? And worst thing possible would be that we're duplicating or because, well, anyway, worst case scenario, we would be duplicating or undercutting what someone else is doing. So that second meeting, we heard from the organization that is the most intimately responsible or close to outcomes in JR. And that is, it's now called the Partnership Council. It's had a number of different names over the years. When I was a part of it, it was the Governor's Juvenile Justice Advisory Committee, and GJAC. And it is still an entity which is called a SAG, a state state agency group, which federal law requires under the OJJPDA, the Office of Juvenile Justice and Delinquency Prevention, from where the state gets a lot of money for juvenile justice actions. And so that's a required piece, and that it is now known as the Partnership Council. It is a multidisciplinary, governmental level. Private actors also are part of this, and they're enumerated in our statute. So they do a report. And we heard from the person, the staff person at the Office of Juvenile Rehabilitation, Office of Juvenile Justice, I should say, Jenny Young, and gave us the most recent report, which we have all pledged that we are going to study. But again, she did a great job of presenting it. We had good conversation, the Q&A. And so we've got what they have come up with and what their priorities and recommendations are as well. So that will help in us sifting through where can we, where should we and where should we not impose our own thoughts. So that's where we are. And we're on the move. Anything else from any of the members?
The only thing I was going to add is that in the next meeting, the idea is to kind of create a work plan as part of the next plan for the meetings. Oops, and I see Lois also has a hand.
Yeah, one thing, let me just respond to Diane. That work plan, we are going to try to get done by the next meeting. If not, it'll be done at the least by that last meeting that we have scheduled already, but hopefully by the next meeting, you're right, which means by the next meeting of this group, we'll come to you with that product. So thanks, Diane. Yeah, Lois.
Hi,
Ooh, what
Bobby. Good morning.
a great picture, Lois.
Oh, thank you so much. I'll be transitioning to my laptop too, but thank you. It's very kind. I just have a question. I just want to clarify at the beginning, you said that, as we work to help DCYF show that what they are doing for our youth is working. And I just wanted to
Or not, I guess.
Yeah, that's what I wanted to find out. I just wanted some clarity on that, because our role is it working or is it not working? Correct?
Absolutely.
Okay. Thank you. I just wanted to clarify because
Yep,
I am, thank you so much.
You bet.
Are there any other questions for Bobby regarding, I see Ben DeHaan has his hand.
Hey, Ben.
Hi,
You
Bob.
remember the Governor's Juvenile Justice Advisory Committee?
I do indeed.
GJAC.
Yes. I've been pressed into service as the chairperson of the subcommittee on the we're calling it on the annual report. And just the title alone indicates that there may be considerable overlap between what we do and what you do, because obviously there are outcomes specified in the annual report that relate to juvenile justice. So we don't have to take that up now. We've only met once. It was earlier this week. We don't have anything to report out yet, but we should think at some point about a connection between the two groups so we don't end up with antagonistic recommendations coming back to the board. I don't anticipate that, but I didn't realize it until you started talking that there could be considerable overlap.
Absolutely. And hopefully unanimity.
Yes, I think so.
Better together.
Yep. Thank you.
Excellent point. Anybody else with any questions for Bobby? I see one more hand, Pamela.
Oh, Pam.
Bobby. So I didn't get to join the first meeting, but I had a question in regards to, aside from looking at the data, which I think would be really useful on figuring out a work plan, has there been any talk for possibly doing maybe like a few walkthroughs in some of the facilities? Because I know like data is very useful, but also seeing it firsthand of how like these facilities are working, I think would really benefit with going hand with the data that was given to us. It's just a possibility, but again, that's like time that would be taken in consideration and
No, I think that's a great idea, and that would be part of the work plan, I would assume, right? Yeah, if if the other members agreed and the board agreed that that was a good use of our time, yeah, I'd love to do that. I haven't been to Green Hill in a long time for us to see, but Echo Glen.
And that I think also overlaps with some of the question that we're going to talk about a little bit later in terms of stakeholder engagement and how we engage with stakeholder groups. So it might kind of overlap into that conversation as well. Excellent point. Thank you, Pamela. I'm going to move us along because I see that Dr. Vicky Ibarra has joined us. And I also want to, before I quite do that, is just thank everybody who's volunteering on the subcommittees. It's very much appreciated. So now I'd like to welcome Dr. Vicky Ibarra, the Assistant Secretary of Partnership, Prevention, and Services. Vicki is going to be providing an update to the board about the Family First Prevention Services Act. Thank you, Vicki. You're welcome to share your screen at any time you want when you want to begin your presentation. Thanks.
Thanks so much, Diane. It's great to be with you all today. I have been invited to present on a couple of topics, so you'll see me and my face and my slides for a while this morning. As always, I'm happy to take questions throughout. I'll try to watch. I'm not able to watch the chat, even though I have two screens up, but I'll try to watch hands and feel free to interrupt me. As Diane said, I'm currently serving as Assistant Secretary for Partnership, Prevention, and Services. I previously served as the DCYF Director for the Office of Innovation, Alignment, and Accountability. And so in both of those roles have been around since the beginning of the agency. And I'm happy to be here today to talk with you about FFPSA. So today, related to FFPSA, I'll provide just a brief update on where we are with planning related to use of FFPSA funds. And then because I understand that claiming was a particular interest of this group, we'll leave time at the end to talk about claiming. And I imagine there'll be questions. Happy to engage in any discussion that this group wants. I think, as you all know, FFPSA is a relatively new federal funding source, a way for the agency to pull down 4E funds, federal 4E funds, to support prevention efforts, specifically to prevent entry or re-entry into foster care. That is how the federal legislation is written. The bill was signed into law at the federal level in 2018, and Washington State was one of the first states to submit and have an approved 4E prevention plan. In order to claim funds, we do have to have a federally approved state prevention fund plan. We have to be providing services that are evidence-based, approved by the 4E clearinghouse, or, and this is new, a culturally responsive tribal preventive service when a tribal 4E agreement exists with DCYF. In the case of those agreements, the tribes are not required to meet the same evidence-based threshold of the 4E clearinghouse, and this is new. And then federal reporting requirements from the agency's child welfare case management system. Those are the requirements for claiming the funds. And these days, I like to talk about FFPSA as a funding source rather than a program. It's not a program. It is a way to support the agency's goals around prevention services. Okay, so where are we at? Whoop, where are we at? As I mentioned, we were one of the first states to have an approved prevention plan. That prevention plan still sits on our external website, so you can see it if you're interested. It expired, though, in December, at the end of December. So they are approved for 5 years, at which point states are required, if they want to continue to have an approved plan, to submit a new one. We did that in December. We submitted a new 5-year state prevention plan. That also is available on our external website if of interest. I've linked to it there at the bottom. We have included new evidence-based practices, including some that were more recently added to the clearinghouse since we submitted our last one. We included some new eligible service populations, what we used to call candidacy groups, and what the legislation calls candidacy groups, but which our community partners told us they didn't like the term, so we call them eligible populations now. Because of the new flexibility for tribal nation services, you'll see that included in the plan. And then we provided additional detail on our vision for community-based pathways. We had provided some preview in the first plan about the fact that we wanted eventually to do community-based pathways, but this plan provides more detail on what that looks like. As I mentioned, we expect to do more work in the community-based pathway space in order to connect families with appropriate services in the community. And we're thinking here about, even though we're not talking about families while they're in the child welfare system, we're thinking about families who are very close to, not just at risk of entering the child welfare system, but very close to the child welfare system or exiting the child welfare system. We know, for example, that as the number of children entering care has decreased so drastically in the last few years, that we're seeing a greater number of high and moderately high risk families sort of churning in the front end of child welfare without placement. And we especially want to be sure that we are providing opportunity for supportive services for families like that, for example, as they exit the child welfare system without placement. We're thinking about community-based pathways in 3 buckets. There's actually a 4th that I'll talk about, but this is what we've included in the plan. I think most of you are familiar with our plan of safe care work. This is a really important prevention pathway, both for pregnant persons who are using substances, as well as infants who are born substance exposed. We've done a lot of work this last couple of years per federal legislation and with our partners like Department of Health and the Washington State Hospital Association to make sure we have a direct community pathway referral for substance exposed infants where no safety concern has been identified. These are usually infants, for instance, born to people who are on medication-assisted treatment, so they may test positive at birth, but the parent is on medication-assisted treatment and is not actively abusing drugs. This also includes many children who may be exposed to marijuana during pregnancy, but for whom there's no identified safety concern. So we want to strengthen that pathway. We want to find a way to get FFPSA funding supports into that pathway. This pathway also includes services and navigation for substance using pregnant people who screen out at intake. We still get a fair number of those referrals. They are not screened in if there's no child at risk who is present, but we want to continue to be able to offer voluntary services for those people. We've had some support from the legislature to expand what was an initial pilot on those screened out referrals, and we'd like to find a way to strengthen those pathways and to get FFPSA support in there. The second community-based pathway that we're interested in is in our family reconciliation service space. Many of you, I think, are familiar with the model that was co-designed a few years ago at the legislature's direction. So we had funding and an opportunity to co-design what a community-based family reconciliation services could look like. And those recommendations that I've linked here mirrored in many ways a previous report we'd done on this topic when we first became DCYF on families and youth in crisis that also suggested a community-based approach. We continue to put forward decision packages. I think we're on the second year now of putting forward decision packages for what a community-based FRS pilot could look like. And I've linked the most recent one here at the bottom. But we think this is also an area where Family First resources could really be helpful for this group of young people. And then finally, the third pathway noted here is with family resource centers. We've been in discussion with family resource centers for years. We've done a landscape analysis. We worked with Akin to produce a decision package for community-based pathways involving family resource centers that's also linked at the bottom. As we know, family resource centers are important community-based hubs that provide high-need families with access to a wide range of supportive services. Although the DP was not picked up in Governor Inslee's budget, and we don't see that it's likely to be any of the FRC-related work is likely to be funded by the state this legislative session, we are still in active talks with Akin. They are accessing some private money to try to build their infrastructure, and we're trying to be supportive of that work because we see family resource centers as key. The other community-based pathway that we think about is the work with tribes. I think we have a huge opportunity to lean into that new exception to EBPs. We have a number of tribal related culturally specific services that we're piloting this year. We've seen interest on the part of the legislature to fund us to provide tribes funding for positive Indian parenting, which is not on the clearinghouse list. So I think there's a lot of momentum for and reason to think we could support tribes to do more of their own tribal prevention services if that's of interest to them. So I think that's an area we really want to lean in on as well. Okay, and finally on claiming. I suspect the question about claiming came because of the paragraph on the left that you will see drop in many of our decision packages that speaks to how we are currently developing the new CWIS system to comply with federal requirements. And for budget planning purposes, our claiming must be linked to CWIS development. CWIS will allow us to do claiming sort of soup to nuts all across inside DCYF, if that's what we choose to do for our community-based partners and other places. So CWIS is really key to eventual claiming. And the agency is still unwinding early premature budget assumptions about FFPSA claiming. So because we were one of the first states in the nation to have an approved plan, we were all excited in those early years to believe that we were on the precipice of being able to do claiming. And we saw that reflected in some of those state budgets that came out shortly after we were approved. In fact, we still have $11.4 million in our budget that is FFPSA authority that we're not able to use. And so we're still unwinding those assumptions that have actually put us back a little bit in terms of expansion of services. So for all those reasons, it's important that we link our claiming to CWIS planning. Happy to answer any about this. I imagine there are some. Ruth?
Well, it's remarkable how complex this. I mean, I think of when we first passed the bill to allow the department to do this, and I hear you saying that you haven't been able to basically draw down federal funding in support of what the department is doing on prevention services. That's just really, and won't be able to for until 2029?
Yeah.
Because of the CWIS issue?
Yeah, the reporting requirement is very strict. If you're familiar with AFGAR's, our regular child welfare reporting, it has to come directly out of the case management transactional system. And as a former director of OIAA, I always thought, well, let's just put it in the data warehouse, because we have a data warehouse for child welfare data, and OIAA could do the reporting. Let's just do that. That's easier. We can, move things around and combine them with other data if we need to. And there's actually a federal regulation that doesn't allow us to do that. The data has to come directly out of the case management system. We are doing some exploration to see if there's anything that can be done with FamLink in the meantime, while we wait, as sort of a risk mitigation strategy. So we are in the process of that exploration now. In addition, fiscal, as they have capacity, is doing some analysis on sort of where is the juice worth the squeeze. So we're not doing nothing. Our CIO is actively engaged in helping to explore what may be small things that we could do to claim in some small narrow areas while we're waiting for CWIS. So we are doing some exploration and analysis as resources allow. But for budget planning purposes, we feel like we really need to.
So Vicki, have other states experienced this same barrier to claiming? I mean, is FFPSA being used broadly for funding?
There are some states, my understanding, so I haven't done the deep dive on other states myself, but my understanding is there are some states like Kentucky that are pulling down substantial millions of dollars in FFPSA Title IV-E, but they have their CWIS already.
Right.
And we are in connection with other states like Illinois that are doing some really remarkable things in their community-based pathway. And recently, just the last couple of weeks, I asked my staff to reach out because it looked to me like they were using an alternative data system rather than their case management system. And if they were getting away with that, I wanted to figure out how they were doing it, but they're not claiming yet. They're doing remarkable work in the community-based pathway, but they are not claiming yet. They're waiting.
Okay, and one final question. You said the current plan has expired and you have a draft plan that's been submitted. Do you have any idea what the status of that is?
Yeah, the feds were supposed to have gotten back to us by today with their comments. And yesterday we received a request for an additional extension of 45 days. So they have another 45 days, and who knows, they could continue to do that.
Yeah.
In December, we put out the whole plan in draft form for public review and comment, and the feds reviewed it. Our federal contacts in Region 10 reviewed it at that time and gave us some feedback. We incorporated that feedback, so we thought we'd be good. But given the change in administration, it's really no telling what kind of comments they'll have for us.
I think one thing just helpful to point out in terms of kind of the experience trying to look state to state. First of all, we all are using different IT systems. And I think the challenge we've encountered is that FamLink is kind of on the older side. I think of the systems that are out there, it is very difficult to modify. So that's what we're sort of exploring right now, is what is possible to modify. We are also in an interesting place with our CWIS system because we will hit a time where we will not be able to make any more changes to our FamLink system because we'll have to essentially freeze that code as we transition to a new system. And so that's some of the timelines that we're working out. The other thing that I think is important to know is that every state uses a very different mix of federal funds. Some states are using a lot of TANF, some use no TANF in their child welfare. It's very state to state dependent. And so I think that's the other thing that we've encountered is that even if we made some of these modifications, the way that we are using federal funds, like social services block grant, other types of funding sources, there isn't a lot of unmatched state, or essentially that we're not that we could use to immediately match to the federal to FFPSA funds. So it's just, I think, a uniqueness of like state to state. It can look really different in terms of like if it's really bringing in a lot of additional resource to the state or not.
Okay, thank you.
I had just two quick questions. Well, one, so if I'm understanding this correctly, you anticipate that the CWIS system would be available and not until 2029. And then once it's available, then you can start pulling in the funding from, okay. My other question is a broader one, which is
And
when
sorry,
you're
Dr.
looking.
Levy, just want to point out that is very that timeline is entirely dependent on receiving funding in this legislative cycle for CWIS, and we will not know until budgets come out whether or not that has actually happened. If we don't receive funding this year, it could push out that timeline even further.
Okay, thank you. And then my other question is, when you're looking at the FFPS, wait, I'm missing one acronym, funding, are you at all looking at partnering with medical practices, since they are often a place where these infants and families are coming into contact with care?
Yeah, that's a great question. In the plan of safe care pathway, the work that's being done to date already has a partnership with medical offices. So most of those referrals come from either hospital social workers or primary care offices. Some come from law enforcement as well, as pregnant people are interacting with law enforcement. So yes, that pathway has a strong partnership through Help Me Grow with medical practices. Thanks.
All right, I see Ben, your hand up.
Thank you, Diane. Good morning, Jenny. How are you doing? Morning, Vicky. Nice to see you. I do have a question about this sort of the stopgap measures that I know that you have a group, I hear that you have a group that's exploring it. Is one of the possibilities to be explored the idea of creating something on a smaller scale that is truly CWIS compliant that could then ingest data from the final CWIS system? I mean, your folks know a lot more about it than I do, but it seems like some states have considered these modular approaches rather than monolithic data systems. And if you're building a CWIS system module by module, the ability to read and write out of these subsystems is allowable under CWIS, where it never was under SACWIS. So I'm guessing that the technical people on your committee have considered that and are thinking about it. But is that a possibility to allow claiming sooner than the establishment of the full CWIS system? Because as I understand it, you don't have a contract yet. And even if you get the funding, standing up a system that large is very ambitious to see it happen in 4 or 5 years. Most people would say it's closer to 7 or 8 years. So is it possible, do you think, to consider some shorter term solutions that would be CWIS compliant?
Thanks, Ben, for the question. The plan for CWIS is already modular, and an ingestion of community-based FFPSA data is already on the planning for CWIS. It's my understanding that some of the more recent CWIS systems, because some have been built already and because there's a fairly small pool of providers who are capable of doing this work, there has been learning. And some of the most recent CWIS systems that have gone up in as little as 3 years. But as to the modular piece, yes, modularity is already a part of the plan. We build an outside of a CWIS new module, not without additional funding, we couldn't.
Yeah. So without making any public commitments, it is a possibility that part of a CWIS system could be used under the right conditions, perhaps, to collect these data before the entire system is up and running?
Yeah, it depends on the order. It depends on the order that the modules are built in, and that prioritization setting has to take into consideration priorities across the agency. So I can't speak to the chances of something like this being ahead of something else.
Yeah,
but it will be modular.
Yeah, and just one last question, and maybe this is for Jenny. Are we aware of any budget assumptions? Let's say assuming full ability to collect data and to invoice the feds. Do we know how much money will be yielded as a result of that, or is it still too early to tell?
So there's a number of things sort of that go into that question. One is that, as Vicky noted and is noted on the slide here, when FFPSA became available, there was an assumption that we would be pulling down $11 million a year, roughly, of additional federal funding. That was already removed from our budget, and we have been under that reduction for a number of years now. We have actually requested that they sort of unwind that assumption because it has not proven to be something that we can actually do. When we've done analysis of the potential earnings under FFPSA, they're relatively small. And again, it goes back to that we are really maximizing a variety of federal funding sources for both staff time as well as services. We use a lot of our maintenance of effort requirements in our service dollars right now. So we have a lot of general fund state, but that general fund state's being used to hold down other federal and cannot be used as matching for FFPSA. So this is part of like this puzzle piece game that we have to sort of do with the federal funding that makes it a little bit challenging. We're very interested in the community-based pathway because it is something that kind of doesn't really exist at scale yet in Washington. The problem that we're now going to experience in addition to sort of CWIS and the technology that Vicky talked about is that we have to go get the state dollars to match the federal funds if we expand like a community-based pathway. And as Vicky says, we've put forward a number of decision packages to sort of start setting that up for like Family Resource Center pathway or FRS pathway, and those have not been funded to date. So I think getting the state is going to be really challenging to match the federal if we want to expand those prevention services, but we remain committed to trying.
I see. And if I could just squeeze in one last question, and that is, are there the tribes that have their own 4E, independent 4E programs, are they eligible to draw down FFPSA funding like they are in other words, having their own plan approved by the feds?
Yes, they are, if they have a 4E approved plan with the feds. I think there are only 1 or 2 tribes in Washington state that have that kind of agreement, and I'm not sure that either of them have submitted their own plan. The other option for tribes now, as I pointed out, is to have a 4E agreement with us, which should be a lower bar, and then allow us to pass through funding. Of course, there'd need to be the matching funding. So in that case, we would probably depend on the tribes to bring their own matching funding.
Great. Thank you.
Okay, any other questions on FFPSA? Family First Prevention Services Act.
You'll memorize it, right, Diane?
Yeah, you know, I always have this thing about acronyms, trying to remember that not everybody knows the acronym. And we do have new board members, so it'd really be helpful, I think, if we try and use, at least at once, it's the start, what the actual acronym stands for. So I may go ahead and move us along. Thank you, Vicky, for going through that initial presentation, but I know you're also part of this next presentation as well. So we're going to move to Jenny Hedden, who has now become an honorary member of the board since she's here so frequently. I want to recognize that she's been here about 3 times, and then she's also been a part of our JR Outcomes Subcommittee. So thank you, Jenny, very much for all your involvement. But both Jenny and Vicky are going to present on outcomes related to racial and ethnic disproportionality and disparities across DCYF areas. In the board's 2024 annual report to the governor's office, we found mixed results for these outcomes. That means that the DCYF achieved improvements for some of the outcomes we examined, but not all. So after this particular presentation, and Jenny is also going to give us an update on the current federal landscape as it relates to DCYF. So thank you both. Take it away.
Jenny, with your permission, I'll just go ahead and share the deck that Sarah and I have put together. So the deck that you see today is has been put together by Sarah Veely and I, and primarily, and Sarah wasn't able to make it today, but because she co-authored this deck and has expertise in some of the areas, I wanted to be sure to acknowledge her.
Hey, Vicky, just before you start, can I ask a question? I know this is a little bit of a longer presentation. Do you want questions throughout, or would you prefer us to hold them at the end?
I think questions throughout would be great.
Okay.
Because then we can, if it's about a particular slide, then we can stop and take a look at that slide. Sarah and I were asked to present last week at the House Early Learning and Human Services Committee on child welfare disproportionalities. So the child welfare portion of this deck is the same as what we did there. And in fact, you can see that interesting conversation on TVW if you're interested. There was quite a bit of interest on the part of those legislators, especially in what you'll see as our culturally specific service line. The deck is data heavy, and you can't have 2 PhDs do a deck and not have data in it. So it is data heavy, but I want to realize that not everyone looks at these data every day. It sounds like you all have included disproportionality in your annual report, so you have included data at least sufficient to identify that there have been mixed results, which I would agree with. I'll try not to perseverate on the data because I don't want to go down a rabbit hole, but at the same time, I want to be conscious of the need for folks to understand it. So if I'm going too fast or not fast enough, please just let me know. Okay. All right. Sarah and I always start with the math of disproportionality. It is a disproportionality, as I think you all know, is underrepresentation or overrepresentation of a racial or ethnic group compared to its percentage in the total population. So we are not comparing populations of color to white populations. We are comparing populations of color to themselves. The numerator in the math is usually the number of children in a racial group who experience an event. We might use child welfare intake as an event. And the denominator are the number of children in each racial group in the population. We also have this thing that we use to measure disproportionality called the disproportionality ratio, which is the same thing, children in the numerator, population in the denominator, but instead of a number, we're using percentages. So the percentage of children experiencing an event, say 30% of child welfare intakes were children of X group, over the percentage of that same group of children in the total population. So if a racial group represented 30% of children in child welfare intake and 30% of the total child population, that would be a disproportionality ratio of 1, and there would be no disproportionality. Disproportionality ratio over 1 means overrepresentation in whatever the event is. Disproportionality ratio under 1 means underrepresentation in that event. And then as I'm sure you all know, racial disproportionality or inequity exists in many social outcomes in the US, with Native and Black children and families often experiencing greater disproportionality in education outcomes, health inequities, etc. And we recognize that DCYF serves children and families who exist first in the context of their communities, well before they come to the attention of our systems. All right. So we have developed this sort of 4-circle framework that has evolved over the last few years as we have worked with our staff across the agency to identify opportunities for intervention related to equity and disproportionality. Broad equity work in the blue circle, culturally and linguistically responsive services in all of our programs and services in the pink circle, the expectation that we're looking specifically at each of our program components, things like eligibility assessments and services. And then finally, the expectation that we're looking across our services and programs to identify specific disproportionalities in agency outcomes that require specific targeted interventions. And while all of these bodies of work are necessary, none of the broad work agency-wide work that we're doing, for example, in the blue and pink circles, by themselves will be sufficient to eliminate disproportionalities. We have to do all of this. We also recognize that eliminating disproportionalities in our priority agency outcomes requires an understanding of the causes, what's leading to these disproportionalities, an understanding of best practices in addressing them, and then implementing specific interventions at sufficient scale to do that. And this is what we try to teach our staff. Where do racial disproportionality in DCYF systems come from? There's a social determinants perspective, a surveillance perspective, and then, of course, differential treatment and support. The social determinants, for those of you who have exposure to public health and other fields, this tells us that many of the social circumstances of populations of color are different than for other populations. Disproportionately high rates of poverty in Washington State, for example, for Native, Black, and Hispanic families. Institutional, systemic, and historic racism often excludes communities of color from opportunity. And then for Hispanic Latino families, many live with immigrant parents with low education levels. And while these families confer many strengths, their children may be more likely to be underserved by the educational system, which affects some of our outcomes. The surveillance perspective tells us that child welfare and, of course, juvenile justice are historically a part of the carceral state, and that Native and Black communities may be over-surveilled by mandatory reporters and subject to bias. And that communities with concentrated socioeconomic disadvantage, which are often communities of color, experience over-surveillance by law enforcement. And then, of course, differential treatment. Once families are in our system, if bias or inequity are present in our assessments, in how we engage families, in decision-making, our systems of care can amplify disproportionalities. So this is what we try to share with our staff about how we understand where disproportionalities come from. In terms of best practices, early in the life of the agency, we did a comprehensive literature review to identify best practices across our systems. And this is sort of a summary across all our systems. A best practice would be to incorporate the protective effects of culture and language into services and supports, ensure we have high quality assessments and engagement with families, access to high quality appropriate services, and this includes geographic targeting and culturally specific services, which we'll talk about, supporting cross-system collaboration, of course, developing our workforce. So that sort of sets the stage. Where do disproportionalities come from? What's our framework for dealing with them? And what are best practices? And the slides that follow are specific disproportionalities that we see in each of our systems, starting with early learning. Our outcome measure, one of our main outcome measures for early learning is kindergarten readiness. And we see persistent disparities in statewide kindergarten readiness by race ethnicity. These are data, publicly available data from OSPI on the WA-KIDS assessment. And you can see here that since 2017-18, about the time the agency started, there has been improvement in kindergarten readiness across all groups, but there remain persistent gaps for American Indian children, Black children, Hispanic children, and Native Hawaiian Pacific Islander children. So what are the interventions we have to help support kindergarten readiness for those furthest from opportunities? We have ECAP and we have high quality early learning. This is a data-heavy slide on the disproportionality ratio in ECAP enrollment by racial ethnic group. This comes from our website, so there's now a dashboard that has this on it under agency performance. This is just a different way to look at it. Like I stretched out the graph so we could see the actual years in it rather than having it squished up. ECAP enrollment is a positive event. So for the disproportionality ratios above 1, for example, Black African American population of children, has a disproportionality ratio in 2024 of 1.07. It's over 1. That means some overrepresentation in enrollment. ECAP is a good thing. We like people to be enrolled in ECAP. So we see here that Black African American children have a disproportionality in most of these years that's over 1, which means overrepresented in enrollment, as do Hispanic Latino children. The groups in 2024 with representation under 1 would be Native American, American Indian, Alaska Native children with a disproportionality ratio of 0.9 in the last year. Asian Pacific Islander children with a disproportionality ratio of 0.5, and white children with a disproportionality ratio of 0.8. None of these are wildly out of the realm of what we would expect, other than the strange uptick in the COVID year for Asian Pacific Islander children. And so we don't consider the proportionalities severe. These are what we might expect to see. I'm sorry, Senator Christian?
Thank you very much. Hey, I'm trying to make sense of this. Your previous graph showed that several of the populations were not prepared for kindergarten, but then yet this shows there's a higher ratio of those, even over the years, of those young folks in ECAP. I would have expected, if we have a higher ratio of ECAP folks, wouldn't that have correlated to the previous slide that showed that there would be better preparedness for kindergarten? I guess I don't see the disconnect. Thank you, if you'd help me out.
Thanks, Senator Christian. It's a great question. So this slide measures all children in the state entering kindergarten. OSPI is doing WAKIDS assessment on almost all children entering kindergarten. So this is a very large population. We don't include population numbers here, but this is very large. The entering kindergarten class each year in public school is about 80,000 children. Of course, the number of children enrolled in ECAP is much smaller. I also do not include number of children here. But what we would see if we overlaid an actual evaluation of ECAP is that it is very effective in helping to prepare kindergarten readiness for those children who are enrolled. But it is a much smaller number of children. Comparatively, when we look at the very narrow population of children enrolled in ECAP, comparatively, those children are getting a benefit. But in order to move population level numbers, we would need to see an expansion of the service.
That helps. Thank you.
Thank you. Ruth?
Well, I just, I know that Washington State ranks very high in terms of the quality of the state preschool program, but I think we rank something like 44th in the country in terms of the number of children that we serve. So we have a very high quality program, but we're not reaching enough children to move the dial on overall readiness for kindergarten.
We can move it for those children who are enrolled, but if we're not enrolling enough children, it's hard to move it for the population level. That's correct. Thank you. Oh, I'm sorry, Diane.
Sorry, that just made me think. So what is our percentage of empty slots now? And is there a geographic predominance of where those empty slots are coming for our ECAP programs?
Yeah, sorry, I'm not prepared today to speak to slots. We can make sure we get those data for you. My understanding is ECAP does balancing of slots, right? So they reallocate slots if they're empty. So my hope is we have very few empty slots, but we will talk about geographic distribution in just a moment. Jenny, can you note that for follow-up? We can have Nicole provide that.
Yeah, I did. And I just want to point out that I think Lois Martin has had her hand up as well.
Oh, I'm so sorry, Lois.
Hi, Vicki. Hi, Jenny. Thank you. A question for you about these numbers. I'm curious as to what role DSHS or DCYF plays in the number of children of color that are enrolled in ECAP in those sites. When a parent calls and says, I have a child and I want to have services or put them in childcare, are they automatically being pointed to ECAP programs, Or are they given the choice to look at family homes or centers based on that family's socioeconomic status? Because I know that there are times, I'm just thinking about the City of Seattle program, and I know there are others too, where a family may call in and instead of pointing them to their childcare program, they say, oh, you qualify for XYZ program, and send them in that direction. I'm curious, is there overrepresentation of these groups? Is that a practice that's happening? That's number one. And then number two, can you explain if there is any correlation between, if we look at especially Black children are overrepresented in the ECAP system, but yet their numbers in WAC kids are still very low. And those WAC kid numbers are based on our ECAP children. So what is the disconnect? If we say we have a high quality ECAP program, why are the children still not doing well? Especially Black African American children in particular.
Thanks, Lois. I think for the first question, you mentioned DSHS, but I think you may have been speaking about our call center. Is that right?
Yes, I'm sorry.
Okay.
I've been doing this too long. DSHS used to be our call
It's
center.
just-
So yes, DCYF.
Yeah. Yeah, that sounds like a practice question. We can certainly ask our early learning leaders to respond to that. As I understand it, the question is, if a family calls and qualifies, are they, it's a childcare call center, so I believe they're being pointed to childcare providers, but we can certainly get the answer, the official answer for you from our early learning colleagues. And the second question, I think, is similar, if I'm hearing you correctly, to what I heard from Senator Christian. If we're doing so well overrepresenting some groups, why are their kindergarten readiness numbers still low? And I think the answer is the same. The children who are being served are doing better on kindergarten readiness, but we are serving a relatively low percent of the eligible population. And as I said, the OSPI numbers are based on the entire population, not just on ECAP kids. There are other reports that look at kindergarten readiness just by ECAP. I think, yeah, I think there are other reports that do that. So we could pull those for you if that's of interest.
Yeah, thank you. I think that would be, then that we were comparing apples to apples, you know, being able to see how the ECAP children are faring, since our statewide K readiness is based on those children that are in the ECAP system.
Yeah, we can get those reports for you. Thanks.
Thank you.
We have a similar chart for children in our subsidy system, high quality early learning, subsidized by the state. Again, not serving as many children who would be eligible. Again, we see Black children overrepresented, but not extremely so. This is not extreme overrepresentation. Anything under 2 on the top end and 1 on the bottom end is not extreme overrepresentation. But we see a similar pattern to what we saw in the ECAP representation. Okay. Diana asked about geographic targeting. So this is something in the absence of sufficient resources to serve everyone, I am a big proponent of geographic targeting because we live in a segregated state with often segregated communities. K readiness by race ethnicity is not equally distributed across the state. And we can use publicly available OSPI data to identify those schools, those school buildings where high numbers of children of color are not kindergarten ready, are arriving to school not ready. And this doesn't mean that these schools or the early learning providers in these communities are doing anything different than other schools or other early learning providers in other communities. This is the nature of our state. We have concentrations of poverty, concentrations of families of color, and thus we see these kinds of geographic clustering. I pulled these data and did this analysis back in 2022, but we could do the same thing with 2024 data. And you see the very large numbers of kindergarten children arriving not ready. And there are some patterns here. A lot of these schools are in Central Washington that serve high numbers of Hispanic children. I've worked in and around Sunnyside. Diane, I know you've worked in and around Sunnyside. We know these communities, and this is not a surprise. Some are in Western Washington as well. For this analysis, I grouped all children of color who experienced disproportionality, American Indian, Black, Hispanic, and Native Hawaiian children. But this same analysis could be done for the separate groups because the public data from SPI is sufficient to allow us to do that. We know from our 2023 Fair Start for Kids evaluation that we can improve access to high quality early learning by targeting supports in high need communities. We demonstrated that we can do that if we do targeting in high need communities. So we have interventions at hand that it could expand high quality early learning in these or other communities that we chose to target. I always like to say with geographic targeting, it's a little bit of math, but these are the numerators in our disproportionality equation. This does not mean that there's actually disproportionality in these communities. But eliminating statewide disproportionality means pulling down the numerator. We have to reduce the numerator. And that's not going to happen unless we can do intervention in these communities that are contributing very high numbers to the numerator. Okay, so these are some things that our early learning system is doing right now to address disproportionality. I'm not going to read all of these, but you see some interventions in the culturally and linguistically responsive services bucket, that part of best practices. You see some intervention in the workforce supports, which is also an important part of best practices, especially where we are contracting for most of the services here. And then you see some targeted investments as well. So we're trying to do what we can within existing resources to adjust disproportionality using the best practices and what we know about the tools that can actually make a difference. Before I move on to the child welfare area, I'm happy to answer any remaining questions about early learning. Child welfare. This is the most popular part of our deck. We have been asked to do this part in many places in many ways. All right. This is Sarah's slide. It's very busy, but it's an advertisement for the new disproportionality dashboard. So OIAA, the Office of Innovation, Alignment, and Accountability that Sarah Veely is responsible for, has just this past year stood up a new disproportionality dashboard. So it allows one to look at disproportionality in child welfare by region, by event, intakes, screen-ins, removals, placement within 1 year, and care lasting 2+ years. It's a lot. And then the data that underlies the spreadsheets that underlie the dashboard are available publicly at data.wa.gov, and those are linked on the dashboard as well. All right, these are sort of our classic slides about disproportionality in child welfare. What we've done here is line up the 3 first events in the child welfare system. Child welfare intakes, screened in and screened out on the left side. In the middle is the screen-in decision or the screen-in point, and then removals on the far right. We use the same measure, disproportionality ratio, which remember is percentage on the top over percentage in the population. And you can see just visually, if you look at those top 2 lines, that they get more as children are in our system. So for American Indian, Alaska Native children, which are on the top, those disproportionalities get greater as they move through our system. For Black children, and that's the second line, those disproportionalities get worse. The other populations have disproportionality ratios of 1 or less. But those top 2 populations, American Indian and Black African American populations are populations of concern. Those groups experience disproportionately higher rates of intakes, screen-ins, and removals than do white, Asian, and Hispanic children. These are the same charts, haven't changed the charts at all, but I want to show you that we can do math with these charts to identify how much of the disproportionality on the removal end, on the far right side, is due to disproportionality at the front end in intakes. It's just a division problem. The disproportionality ratio of all intakes divided by the disproportionality ratio of removals. And doing that, we can say with confidence that 70% of the disproportionality in removals for Native American family children and almost 90% for Black and African American children happens at intake. Families being reported to us that most of the disproportionality is due to that. There is disproportionality added as they move through our system, but most of the disproportionality in placement is due to disproportionality at intake, or is related to, rather, disproportionality at intake. That's an important point to remember for us, and it speaks to our need to intervene on the prevention side as well. Yes, Senator Christian?
Yeah, thank you. Where can we find the actual numbers? These are ratios or percentages, but when we compare the actual numbers of actual children or families with being removed, where can we actually find that data?
So it would be on the disproportionality dashboard that was a couple slides ago, and then I'm going to have some numbers in a couple of slides as well. So you'll see. Yes. Great question. Thank you. Okay. And then we can't talk about child welfare involvement without talking about the role of poverty. Poverty is the single largest population risk factor for both child welfare system involvement and child maltreatment. On the right, you see a chart that details the number of children coming into care. That's on the right axis, and with the line, that's the number of children coming into care. We see the huge drop since 2017. And on the left axis, and in the green bars rather, you see the total number of children in Washington living in households under 200% of federal poverty. National research suggests, and in Washington, our data suggest that there is a substantial population level relationship between poverty and child welfare involvement. And in fact, national research shows that this has grown stronger over time. This relationship between poverty and child welfare involvement has grown stronger over time. In our state, we know that at least 20% of our families who are involved in child welfare are what we call economically disconnected from either work or public assistance. And we also know from national and state research that income support programs can be an important population level intervention to prevent child welfare involvement and maltreatment. There's research on the minimum wage, on SNAP, on child tax credits. The expansion of the federal child tax credits during the COVID period was thought to substantially reduce what we expected would be an increase in child maltreatment. So there is good research to show this relationship, and whenever we talk with policymakers, we always make a point of emphasizing that anything that can be done to keep child poverty down in Washington state will help address this. All right, one more chart. And we can test, we can do some high level test on the effect of poverty on our own disproportionality. We do that by using a different denominator. So most of the charts you've seen up to now, when you see a disproportionality ratio, the denominator are all children in that group in the state. But we can constrain that denominator to just children in households under 200% of federal poverty. While we don't have the income level of every single family involved in the child welfare system, previous studies have suggested that over 90% are in this low income category. So this seems a reasonable thing to do, and other researchers have done it. When we do this, we see a substantial reduction in disproportionality, but it doesn't go away. It's still there. This is, we used removals here as an illustration. On the dashboard, you're able to select under 200% of federal poverty and see how that affects intake, screen in, and length of stay, in addition to removals. So we know poverty makes a difference even in Washington State. All right. This slide points to some research we did in 2022 in Sarah Veely's division that looked specifically at safety concerns that were presented by race ethnicity. And we do find that Black and Native families present to DCYF with greater safety concerns on average, which could contribute to the disproportionality in removals and that accrues as we go through the system. Now, we can't rule out that the assessment isn't biased. We can't rule out that there's not bias in administration of the assessment. But when we did the research in 2022, we did find that there were greater safety concerns in Black and Native families, which may speak as well to the supports that are needed by Black and Native families. Senator Christian, here's where I've got some numbers for you. We do have some evidence of progress. On the right, you see the number of children from each racial ethnic group who've entered care in the years noted here. And you see substantial reduction in all groups. And yes, the largest group on the far right are white children. And they have seen the greatest reduction in part because they had the highest numbers in the first place. But all groups have experienced a reduction in entry into care over the last few years. That number for Black and Native children is lower now than it has ever been before. We also know from economic analyses that fewer Black and Native children are living in poverty in Washington than a decade ago. That is a really good sign. In the last year, in calendar 2023, the last year of the previous charts, there was a decrease in the disproportionality ratio for both American Indian and Black children, both adjusted for poverty and not adjusted for poverty. So we have seen some progress here. We know we still have a lot of work to do. Because we're often asked, we included this chart. It's a little dated, but we expect the data would be similar today. We see little or no disproportionality in kinship placements for American Indian and Black children. In fact, DCYF and the previous Children's Administration had a strong history of kinship placements for children of color. This is a strength. This is a best practice, right? Keeping children connected to their culture, to their communities. This is an important piece. I see Lois's hand is up.
Yeah, thank you, Vicki. Can you share on the numbers you said where the number of children and families in poverty have gone down for some families of color? How does that compare in relation to the number of the population of that group overall in the state? Has that number decreased or increased?
Yeah, I can't say for sure, Lois, although I'm happy to dig into that link on the economic stability indicator, which should have it. I can't say for sure. The number, we know that births in the state dipped, right around COVID. And I think they've started to come back up, but I would expect the number of children has gone down a bit overall. But we'll dig into that a bit and get you more specific information. Thanks for the question.
Thank you.
Okay. Geographic targeting, another best practice as we saw with early learning. These are numbers pulled in, I think, 2023 or early 2024, but we do this each year now. Pull the numbers of the offices, so the communities where the highest numbers of Black and Native children are placed, and then use these communities as a way to target prevention, voluntary prevention interventions. Again, because we live in a segregated state, these numbers tend to cluster, and since they are the numerical disproportionality ratios, we need to work on reducing these numbers. So we can use these in targeting interventions. For instance, we have a culturally specific pilot going on right now with braided funding, both state and philanthropic funding, And we used these communities as a way to say we would really like to have proposals from these communities. We partnered with the communities to identify potential interventions, and then are implementing projects right now. And we're trying now to update these numbers each year so that new interventions that might be available, for instance, if we have home visiting expansion, or if we have other programs that are expanding, that we can use these geographies as one way to think about where we want to put those new services, or where we want to encourage contractors to apply. Again, lots of other efforts related to racial disproportionality happening in the child welfare system. I'm not going to go through all of these, but in practice, we have things going on. In contracted services, we have things going on. And in placements, we have things going on. I think of interest to this group might be the last bullet under practice. Child welfare has now designated racial disproportionality leads in each region. So they have one for each region. That examine local data and work on local practice. So they take up efforts that have been prioritized by the region and that their data say need attention. They serve as expert consultants to help on specific cases, and they work with staff in the local region on efforts to reduce disproportionality in the local area. I mentioned the culturally specific services. We're really excited about that. Those are contracts that we've tried to partner with communities on, going to the community, saying, what is it you're interested in? Putting out in our RFI, here's some things we think might be effective, but you tell us what's going to be effective in your community. And in that way, we have a real variety of services that we're funding. For those items we can fund with state funding, we're using state. For those items that we can't use state funding for, we're using philanthropic dollars. We have a great partnership with the Balmer Group for that. And then we'll be evaluating this pilot this year and hope to have some recommendations by the end of the year for scaling. Before I leave child welfare and move on to JR, happy to answer any questions about disproportionalities in the child welfare system. Diane?
Do you have any data on any disproportionalities that might exist in the group of children that re-enter care at 12 months yet?
Re-enter care at 12 months. We are very concerned about the group of children who re-enter care. It is a very small group. We can look. We have lots of data on those kids, so we can certainly look. Thanks. I would expect that we would see disproportionality.
That would be sort of similar to what you've seen in other parts of, okay, child welfare. My other question is, when you're talking about interventions like the geographic targeting, which sound great, how are you measuring whether those efforts are actually working?
Yeah, so this is fairly new for us. And we, you know, as an evaluator, I would want to do a quasi-experimental and actually look at this, but at this point, what we're looking at is it feasible? We're in the formative stage. Is it feasible to implement these kinds of contracts? Are they scalable? And over time, are we reducing the number of children entering the system and entering placement? There's a time lag there. So entering the system and then entering placement over time, are we able to reduce that? So I think over time, we'll be able to do more rigorous analysis, but initially is this feasible? And does it look like the numbers are going in the right direction? Thanks. Okay. All right, moving on to juvenile rehabilitation. And I'll just caveat ahead of time, my partner in this presentation, Sarah Veely, is the real expert on juvenile rehabilitation. So you have a poor substitute in me today. Let's see. As with child welfare, racial disproportionality compounds as young people move through the juvenile justice system. Black youth have the highest rates of arrest and adjudication. And an arrest is a precursor to adjudication, and adjudication is a precursor to commitment to JR. So similar to child welfare, we see higher rates among Black children and Native children and Hispanic children, young people, in this system as well. These are graphs that are also available publicly on the OIAA page on JR admissions and release by date. These are numbers. This is not disproportionality rates. So you see that white young people are there at the top in terms of admissions, as well as on the top in terms of release. You see there that Black children, Black young people. I have to train myself. I'm talking about young people. This includes adolescents and young adults, and Hispanic young people. So those are the groups that tend to be overrepresented in the juvenile justice system. This is client movement to and release from community facilities. Community facilities are the least restriction option as a part of the reentry continuum, and across all racial ethnic groups, youth who are eligible to stay in a community facility based on law have comparable access to community facilities. About 1/3 of young people who by law have access to community facilities have are accessing them. We see that Black youth are returned from the community facility to release from an institution at a higher rate than other youth, and this requires further intervention. So there is an option for young people to go from a community facility back to an institution before release, and that is happening disproportionately for Black youth, and that requires further investigation, which we're looking into now. This is the percent of the obligation spent in an institution or community facility by racial group. So you see here the percent of their obligation, the number of days spent in a community facility is in red, and then the percent in terms of number of days institution is in purple by racial group. So here we see that Black or African American young people spent a substantially lower percentage of their obligation in a community facility than any other racial group, on average 37%, compared to an average of 43% for other racial and ethnic groups. While the smallest portion of the JR population, Asian Pacific Islander youth, have disparate access to parole services. They are a small number. 4 of 14 young people in this graph, they had the least access to parole services. And then this is room confinement and isolation, which we try to monitor closely. We have internal and external dashboards now stood up for room confinement and isolation, which is a particular area of concern. And here we see that American Indian Alaska Native youth while they account for 5% of the JR population, they account for nearly 10% of all room confinement and isolation events. I'm sorry, Bobby?
Could we go back to parole for a sec? It was my understanding that we didn't have many kids eligible for parole or on parole. Is that true?
That's correct. That's true. We do not have very many. This is so there were only 14 Asian Pacific Islander youth in this whole sample. I don't have the total sample, but my understanding is if we access this dashboard annual fact sheet, we could get the numbers. But you are correct, it's not high.
Yeah, so it's a tiny number anyway. Yeah, thanks.
All right, room confinement and isolation. And then what are we doing to address racial disproportionalities in juvenile rehabilitation? We've implemented behavior management system to emphasize restorative and procedural justice, designed to reduce bias and provide opportunities for youth voice. We've leaned into our multidisciplinary teamwork to individualize and make the review of residents for eligibility for less restrictive placement more impartial. We have a multi-tiered system of supports to ensure every young person has equitable access to instruction and supports they need to thrive. And we are increasing our culturally relevant programming on our campuses throughout the state. Those are some of the things we're doing right now. Jenny, I see you had a comment in the chat.
Just to follow along to the question about sort of parole specifically, but that we also offer voluntary post care services. And so that might be something we can also sort of look at as like who's involved in the sort of formal system and who's uptaking into that sort of more voluntary system of supports.
And well, and of course, what are the eligibility requirements to be offered those services too? That would be interesting data for sure.
Yeah, and so we're offering 100% of youth that are exiting, we offer the option to do that voluntary post-care services. So there's no eligibility requirement for that particular programming, but we could certainly look at like who's uptaking and why.
Yeah,
to various ones for
great.
sure.
Super.
Ruth?
Well, that is very encouraging, and I'm wondering when that began and if you're, you know, how long it's been in effect, if you're able to see any impact of that, because that has been a huge issue for a long time.
Absolutely.
Yes, we can definitely do some follow-up. I think we'll want to do a little writing up on it. We're pretty proud of that program, and so happy to kind of give you guys some more detail and send that as part of our follow-up.
When did it start?
I'm trying to remember. It's been in place for a couple of years now, and it was something that we chose to sort of do. And we're especially interested in some of the, we're doing a lot of work on substance use disorder treatment inside the facility, and that's part of also that aftercare services, making sure that we have that linkage to healthcare, linkage to ongoing SUD support in the community. So I'll could definitely follow up with some more information on that.
So we're talking post-COVID?
Yes.
Okay, so real recent. Okay, but you
It's
are
fairly-
assuming there's data being collected on the.
We know
Six-
who's enrolled in receiving services under that program, so we can certainly take a look.
And outcomes.
Sarah was here; she would be able to give us a whole.
I know Sarah. She came
Oh,
from
yes.
my branch
Yes.
of government. You know.
She did. She did.
Yeah, you're lucky guys to have her.
You know that. All right, so that ends the presentation. You have the entire deck. So if you decide you have a question afterward that we haven't talked about today and you want to get additional information, please just shoot us an email and we'll get that for you in addition to the items we've noted for follow-up today. Thanks.
And then I think, Jenny, we're going to thank you so much, Vicki and Jenny, for your time and talking about those. That's such an important area that we need to keep our eye on, the disproportionality and disparities in the system. I think, Jenny, we're just going to roll right into you and your federal update, if that sounds okay.
Yes, absolutely. And I feel lucky, I guess, that this is going to be a relatively short update. We were not sure, and thank you, Vicki. She always does.
No news is good news from the feds.
I know, right? So we were obviously anxiously awaiting to see what would happen with the continuing resolution that happened last Friday. That did ultimately end up passing, as I think probably some of you are aware. And so we are, and that is good for now an entire year. So we were not sure whether or not we'd sort of see that sort of kicking the can down the road. We certainly could see, additional proposals. There is obviously also court cases moving through related to whether or not the executive branch has the ability to sort of reduce funding on their own. But I'm happy to announce that we have very little impact from the continuing resolution. So we did not see a federal government shutdown, which would have been not good for us. And we also didn't see a significant reduction in our resources related to the CR that was passed. We are still doing some analysis because those are complicated. And we have a variety of federal funding sources that we access. And so we're still doing some level of analysis, but I'm happy to report that I have very little news other than sort of continuing as we are with our federal funding sources for the moment.
Any question from board members for either? Let's see, is Vicky, did she take off? So it's Jenny. Any questions for Jenny?
For her.
Yes, thank you. I'm not seeing a lot of hands. Oh, there's Ruth. Ruth has got a.
So I was reading the minutes from the last oversight board meeting and the, crisis that you were thrown into with the freeze. I just want to be clear that at this point, you're able to draw down the funding and you're operating basically at a continuing level.
Yeah, we're essentially operating as normal. I think the only thing we saw a brief kind of disruption in the ability for our federal folks to answer questions. So that kind of created a little bit of delays, so specifically, especially like in our IT systems. We are interfacing with them really regularly, our federal oversight at ACF, the Commission Children and Families. So we're a little bit worried about that. We're also still worried about depending on what level of layoff might happen at the federal level, because again, we have a lot of back and forth with a variety of federal entities on our grants, and so sometimes that has been delayed. It looks like that's starting to people are being able to like answer our questions and meet with us again, which had been delayed for a bit. So hopefully we're not going to be too impacted by some of those layoffs.
Okay, thank you.
Bobby?
What about questions coming from the other side? Are inquiries being made about special programs maybe for LGBTQ kids in the systems, the racial disproportionality work that you're doing, the mitigators, for example? Questions arisen yet about them? I say yet, but because I know that some nonprofits have just been riddled with stuff.
Yes, so we are still working with our attorney generals on issues like there was some directives around removing any references on our websites to federal programs. We are anticipating that there will likely be questions about some of the work in the diversity, equity, and inclusion space, as well as in the LGBTQ area. I think this will be interesting as, we're talking about our FFPSA plan. We lean heavily into those issues in that plan. And so that's kind of a little bit of a trial balloon, I think, for us of like, how are the Fed's going to deal with that? But so far, we have not seen a directive explicitly to not use funds or a change in the way that we allocate to federal funds at this point in time.
Okay, thanks.
And we're keeping our attorney generals very close with us. So if we are seeing issues, we are alerting them as well.
That's great. Yep.
Well, we sure appreciate your willingness to come in and spend time with us this morning. I would love to take the opportunity to move our break up perhaps right now, because if we left now and came back right at 11:10, we could start public comment right then, and then we might be able to leave a little earlier. How does that sound to folks? I see a thumbs up, thumbs up. Nobody seems really against having a break right now. So why don't we, Danielle, yeah, there's just hands up. Great. I'm assuming that means you agree. So we'll take the break now. We'll be back. Most people here. So right now, we're going to start our public comment portion of the agenda. I'm going to start by reading the DCYF Oversight Board public comment statement. The DCYF Oversight Board operates under state law, which outlines its authority and responsibilities. Specifically, the board is responsible for monitoring DCYF's progress towards achieving outcome measures, for ensuring DCYF's compliance with applicable laws and policy, for overseeing DCYF's performance and policies, for offering advice and input to DCYF, the legislature, and the governor's office. While the board may consider information brought to its attention as part of its general oversight and monitoring role, it does not have the authority to investigate, direct, or alter DCYF's decisions in individual cases. Additionally, during public comment periods, neither the board nor meeting presenters can respond to comments beyond a simple acknowledgement. To respect individuals who may have sensitive stories to share or wish to discuss details of individual cases, we'd like to remind you that the board is subject to the Open Public Meetings Act. That means that our meetings are open to the public, recorded, posted on the Oversight Board's website, and live streamed on TVW. Written public comments submitted in advance have been sent to the board members. So for this particular meeting, we had about 10 different written comments submitted to the board previously. So for today's public comment period, we have 4 folks signed up. And to ensure everybody has an equal opportunity to speak, we're going to ask you guys to limit your comments to around 3 minutes. Thank you for all of those who have signed up, and we're going to start by hearing from Kathy Elkins.
Thank you very much. This is Kathy Elkins, and thank you, esteemed members of the DCY Oversight Board. My name is Kathy Elkins, and my question is, how many children and families has DCYF in Washington State harmed with false accusations or missed opportunities to protect children? No one here can say for certain whether more families have been hurt or helped, but we do know too many innocent families are falsely accused and too many abused children are left unprotected. Your January minutes say this about my comments. She believes DCYF took part in the quiet removal of the doctor who misdiagnosed her granddaughter with a skull fracture. I did not say that. An ER doctor made the skull fracture misdiagnosis. Dr. Lamb tried to cover it up and was negligent and unethical in many other ways. I use that as a segue for my topic today. It is nearly impossible to accurately document words said. That is why today I'm here to ask that DCYF allow families to record their interviews. The system is too broken, and this will reduce harm from false allegations and missed opportunities to protect abused children. Washington is the only state that does not allow punitive damages and requires two-party consent for recordings. When documenting, unethical people falsify, good people err, and families and children are left defenseless as they cannot prove the truth of what they said. Accurate investigation should be the priority over trying to protect yourselves from liability. People talk 6 times faster than they write. DCYF caseworkers are told to record conversations close to verbatim, but they cannot document every word. They have to pick and choose what they think is important at the time. Notes are often written days later from chicken scratchings, leading to errors and omissions. Hours are wasted doing this from memory or illegal recordings. Sorry, I'm a teacher. This is my planning. Sorry about that. And decisions are made based on faulty information. It sure appears that in the Thigpen case, private conversations were secretly recorded by DCYF to transcribe later, but they cannot share them with families because it is both illegal and against policy to have done so. I will provide excellent examples for you. This is 2025 and there's a better way. Record interviews if the family allows, allow the family to record or share with the family, and then use speech to text software to fully transcribe conversations, saving millions of dollars and reducing wrongful child removals. Legislators can change laws to make child abuse investigations an exception to the two-party recording rules. And then just briefly talking about disproportionality, as a math teacher, we teach causation versus correlation. I do want to note that hospitals are routinely telling their doctors to look for family income as an indicator, and doctors do not have access to family income. So what the doctors are, the only thing they can do is decide based on how someone looks if they want to accuse them of abuse or not. I'm very concerned about that. I've seen that with multi-care, and I'll be happy to share those slides with you. So thank you very much, committee. I appreciate you.
Thank you very much for coming in and giving us your public comment today, Kathy. Next up is Shannon Cherry Anderson.
Hello. Thank you for this opportunity. I'm Shannon Cherry Anderson. I'm the Region 3 elected volunteer 1624 caregiver rep. I was asked to read this letter. It was submitted anonymously by a provider. They have feared retribution if they came forward themselves. You should all have a copy of it in its entirety, and I encourage you to read it. I know I only have 3 minutes, so I'll just get started and see where we end up. Dear DCYF Oversight Board, I'm writing because I can no longer remain silent on the devastating effects of House Bill 1227, increasing the standard of removal to imminent risk of physical harm on the families and children of Washington. I'm a combined in-home provider contracted by DCYF to provide parenting services, including family preservation services. As a contracted in-home provider for DCYF, I've witnessed firsthand the unintended and harmful consequences of this law. I want to share what I and my colleagues are seeing and experiencing since this law went into effect. She goes on to highlight 5 areas of concern, so I will go quickly. She says, I am committed to helping families stay together and genuinely care about the parents and their children. It is because of this dedication that I'm speaking out, and I believe the current approach is not effectively supporting them. One of the unintended consequences of this law is that less families are actually engaging in the services. First, we've seen a reduction in referrals. Referrals had reduced during COVID and have gotten back to where they used to be. One of the reasons for this is that intake calls that used to screen in don't. This is a direct result of the law because changing the safety threshold means that it has to be very bad until it screens in, or it is taking numerous calls to get responses. Next, when we get referrals, the parents are turning down the services or they will briefly engage and then don't. So many of my cases have been closed by the social worker because the parents didn't want to continue services, but yet the concerns are still there. We just have to wait until it screens in again if the children survive that long. And while DCYF reports many indicate a certain number of referrals being sent, these numbers do not reflect whether the family was seen, completed the service, or incorporated parenting skills in their lives. Another argument could be a decrease in children in care means a decrease in referrals, but that should not be the case. But we should be getting more referrals for preventative services while the children are still in the home. This is not the case because parents are not agreeing to do the services. House Bill 1227 was said to only impact initial removals, but that is not true. We're seeing children return home after 2 or 3 years in foster care because the parent has another child. Due to House Bill 1227, the newborn is not removed, and the judge cannot justify why a newborn is safe with the parents while the older children are not. Family preservation service is a concern for this author. The most effective service for situations we're encountering is family preservation services. However, many providers are reluctant to take on FPS cases due to the inherent dangers involved. We're often asked to enter homes that are genuinely terrifying. These are places where we must wear masks, not for fear of illness, but because of an overwhelming stench of dirty dishes, animal and human waste, and other unsanitary conditions. Sometimes the conditions are so severe that we have to meet clients outside or in alternative locations, yet the children are left in these homes that pose a significant health risk. We're also asked to visit homes where parents are actively using drugs, including fentanyl. We must carry Narcan in case our clients or their children need it. I also explain the Good Samaritan law to clients, hoping they will use it on me if I am exposed so that I can return home to my family at the end of the day. I know I'm getting close to time if I'm not already. So her other concerns are ineffective safety planning, just to highlight, but please, I encourage you to read the letter in its entirety, lack of accountability. And I'm going to jump to her final thoughts because I don't know where I am on time. While DCYF acknowledges that the rising fatality rate among children is linked to the fentanyl crisis and the lack of adequate treatment facilities, I'm not seeing sufficient action to address these critical issues. There needs to be more substance abuse treatment centers, especially those that allow children to stay with their parents during treatment. Currently, children are left to fend for themselves. The focus should be on protecting children amidst the fentanyl crisis. We must be flexible and adjust our strategies to meet the challenges posed by the crisis. Moreover, it's not only the increase in overdoses among babies that is alarming, but also the rise in physical abuse cases. Finally, I urge you to listen to the concerns of in-home providers, social workers, and first responders who are grappling with the realities of this law. Engage with your local community. Ask them to share their experiences. In a recent article by King 5, one of many they are writing about this issue, it is stated, in one case in Kent, police body camera footage shows officers responding to the same family 3 times over 16 months, each time finding a toddler in the car with his parents who are slumped over. They're smoking fentanyl while he's back here, one officer said. We had the same issue with them 2 months ago and we took the kid. CPS gave them back. How is this helping families? We're returning children to parents in active addiction only to have them sober for a short period of time. They say they return the children. I'll just
So
get to
Shannon,
I know I'm way
yeah,
over.
I know. That's all right. If you can just maybe summarize in the next 15 seconds or so, that'd be good.
I will totally. And her big takeaway at the end is, please, if you have the opportunity, we encourage everybody to get an accurate perception of what everyone is dealing with, possibly shadowing a case. Don't let them choose an easy case, but have them take you to the house that everyone is scared to go to, that they have to wear a mask and they can only go in there with 2 of them. We strongly advise you to take your Narcan and a change of clothes. So please consider the children that are being left in these unsafe environments and experiencing additional trauma. And signed, one heartbroken, losing hope, and suffering from PTSD combined in-home provider. Thank you.
Thank you so much for going through that. And I will remind the board that we do have that in our written comments, the entirety of the missive that she was reading from. Okay, our next public commenter is Victoria Rivera.
Thank you. My name is Victoria Rivera. I made a public comment last month for the push for policies and legislation that gives innocent families with complex medical cases a chance to protect their parental rights and keep their families together. Today, I want to share some examples of scenarios from these families and why it's crucial that we take a look at this. There are families who have no drug use or criminal history who take their infants to the ER for lethargy, swollen limbs, there was a fall, or maybe their medically fragile child is presenting with unknown symptoms that warrant concern. And their child gets reviewed and doctors come to find that, oh, there's a bleed in the brain or some unexplained fractures. And right at the get-go, it sounds very serious. And yes, they should be taken seriously. But did you know that there exists reasons other than abuse as to why there could be brain bleeds, such as birth trauma, prematurity, vitamin K deficiency, and in cases of unexplained fractures, there exists scientific evidence that shows that these can be caused by birth-related trauma, metabolic bone diseases like rickets and osteogenesis imperfecta, and genetic or connective tissue disorders. And because these doctors exist solely, these pediatric abuse doctors, they exist solely and trained to look for, identify, and diagnose abuse, many families are becoming collateral damage in the system. And as for DCYF, CPS and child welfare services do not train to identify health concerns. They're trained on identifying abuse and abuse prevention. And now just imagine, okay, for 1 second, how difficult it is for innocent families to challenge professionals working together like this. I had someone told me, well, at least we know the system works. Abusers can't get away. No, the system's not working if you have innocent folks on the chopping block standing in front of a judge waiting for the decision for the termination of their parental rights for something they can't explain. DCYF's, appeal to authority and mentality for better safe than sorry has harmful repercussions for innocent families, such as labeling these parents as angry and belligerent, in denial, or inadequate protectors of their families, harming their ability to regain custody of their children. Most importantly, our children are the ones who lose and get hurt the most. And we need your help This problem isn't just a medical problem, not just a scientific or just an abuse problem. This requires brave leaders in all sectors to look our way and find solutions. While I know this board can't do anything about the scientific dogma of the medical community when it comes to diagnosing abuse like a medical condition, I do know that this board can bring into question how we handle these cases. One thing this committee can do is to help mandate the collection of comprehensive data on child abuse investigations involving doctors contracted by DCYF. By strengthening oversight of the medical reviews, it will help identify and address systemic issues, ensuring a more fair and equitable child welfare system for all families. Families want to see that these doctors are acting in the interest of families and not in the interest of what lines their pockets. It should be the priority of the leaders on this board to understand how the medical and scientific controversies that intersect with DCYF impacts not only how social workers and doctors investigate and determine abuse.
Thank you, Victoria. Can you just wind it up, please?
Yeah, but also how it impacts families caught in the middle of these controversies. Thank you.
Thank you. And then we have Angela Kramer.
Thank you for allowing myself and others to testify today. My name is Angela Kramer with Angela's Family Services. I have been a family time provider for nearly 17 years. I service both sides of the state. I service between 40 to 45% of all the families this side of Snoqualmie Pass, Region 1 and Region 2. I did not think to submit anonymously, as I hope that the integrity of DCYF and legislation would not retaliate by expressing concerns that so many others have also brought forth. I understand that much of this is outside of DCYF's hands, but it is a legislative and judicial issue as well. Since the implementation of House Bill 1227, there have been concerning rise in infant mortality rates and child injuries. It is imperative that DCYF collaborate with legislators to either reverse or enhance this bill. Of particular concern is the practice of not removing infants from mothers who are actively using fentanyl and meth upon birth, as placing children in environments where these substances are present poses serious safety risks. Our firsthand experience during family time visits has shown that parents under the influence are often unable to properly care for their children, putting their lives at risk. This trend of increased fatalities and injuries not only jeopardize the well-being of children, but also expose the department and the state to potential lawsuits, thereby impacting the state's budget significantly. On a personal note, this is also close to my heart because when I was born, I was addicted to cocaine and heroin, had to spend a significant amount of time in the hospital detoxing. I too was sent home from the hospital with my biological mother. I spent the first several years of my life in and out of the system. I was eventually adopted and grateful every day because my life would have been so different if I had not been permanently removed from my biological mother. I had an older brother who was not so lucky. He was not removed by the department. He ended up getting involved in drugs early in life, was in and out of juvenile hall, and eventually, at the age of 22, committed suicide. I urge DCYF legislators, members of the judiciary, and providers to unite in ensuring the safety of children. Addressing safety issues observed during family time is more frequent. The case that court orders is more frequent that the case that the court orders place both providers and children in unsafe situations, making it challenging for us as providers to maintain a safe environment. It is not long ago, 2012, that Josh Powell brutally murdered his children, and they died during a scheduled supervised visitation. Memories are often short, but it is important to understand the safety risks that providers and children are placed in daily on supervised visitation. As a family time provider, we have unique insight into parent-child interactions, yet our input is frequently overlooked. While our observations may be unbiased and valuable, we are often left out of crucial conversations. Our observations during visits can play a crucial role in assessing the parent's readiness and capability to care for their children, and we believe that our perspectives should be given due consideration. Thank you for your time.
Thank you very much for providing public comment. And I think with that, Nicholas, does that end all of our public comment?
Yes, it does.
Okay, so we already had our break, so we can move right along to revisiting the board's shared value document. And I think, Laisha, you're gonna be the one directing this conversation.
Yes, thank you, Diane. So I didn't introduce myself in the beginning, but hi, everyone. Laisha Marcinishin, Executive Director of the DCYF Oversight Board. So we are going to do somewhat of a big transition now and really focus on the board shared values document. I recently sent a request to the board to provide feedback on this statement. And the statement was created in 2019, but near the beginning of the board's formation. However, it has not yet been updated. Note that we recently passed the 5-year mark. And so I think it's a terrific opportunity to spend a little time revisiting the shared values in relation to the board's mission, its code of conduct, and for any changes or updates that might be needed. I want to thank Lois Martin for her feedback on both the content and organization of the statement. I very much appreciate the time you took, Lois. So in a moment, I think it would be great if we discuss the shared values document as a whole, but I'm going to step back for a second and just say I also received feedback about members regarding the use of titles. So for example, senator, representative, doctor during board meetings. Currently, the shared values statement encourages people not to use titles. However, of those people who provided feedback, all of them indicated that they would prefer to use titles. So I just wanted to ask the board this question: does anyone have a different preference that they would like to share that's different than the members who provided feedback indicating that they would prefer to use titles during board meetings? Not seeing any hands. I do know that we are at quorum, so I think Co-Chair Levy, we could vote on this. Would that be appropriate? You might be on mute.
Sorry, I was I raised my hand instead of unmuting. So I don't know, do we absolutely need to vote on this? I think, or is this something that we can just kind of agree to?
That's my understanding as well.
Okay, well, I was kind of interested, maybe even before we go that, if if some of you have been from the very beginning with this group, is there any comments about the initial draft of the shared values statement and whether you think that that has drifted at all? I'm not seeing it. All right, so let's take a vote on the first while you're pondering that. So all those in favor of using titles rather than first names when appropriate during board meetings, please signify. Maybe let's have you do a raise your hand. Of course, you could also say aye. You can tell who's not the legislative one here. Okay, is there anybody that would like to say nay? Or abstain?
I personally don't have any strong feelings about it one way or another. In some respects, it doesn't matter because even when we said we wouldn't use titles, we can't seem to break the habit anyway. I personally can't break it. When I see a legislator, representative, or senator, I'm very uncomfortable not using their title because of years of using the title. So I think it's really a matter of preference. I don't have a strong preference one way or another, but I am going to continue to refer to representatives and senators by their title because I can't help it.
Yeah, I think that that's kind of the way I think a lot of us were feeling, is we were just going and using people's titles anyway. So let's just be formal about it. And then I personally also kind of, if somebody calls me Diane, I'm not going to call them to the carpet for not saying Dr. Levy, because that, you know, it just seems like I could respond to either. So I agree with you, Ben. It doesn't seem to be something that we need to be overly stiff about. Any other comments? Okay, so having completed that particular piece of business, I want to kind of just go back to those of you who were present with the shared values at the beginning and maybe give us a little historical perspective, if you would, on what your thoughts were when you were drafting that document. And if you think, I guess one of the reasons I ask is when I looked at that document, it looked to me like it was a compilation of comments that had been brought up during a meeting and that it hadn't really been, you know, synthesized or kind of down into a more workable size. And I think that's something that would be very appropriate for us to do. I agree with you, Lisha, at the 5-year mark, or now closing in on 6 years, that this would be a good time to do it. But I didn't know if any of the people that were in the board initially had any thoughts about that.
I think it came from the original board retreat, didn't it, Ruth? Yeah, that's what I recall. And it really is a reflection of comments. So it was kind of a consensus document, and is how it was all dealt with, rather than going, you know, parsing it as we were sort of trying to do a moment ago.
Go ahead, Ruth.
Well, it does reflect a very aspirational kind of perspective on the role of the oversight board, and many of the goals in here, we do not have the staff resources or the time, or have not had the staff resources or the time to carry out. So, you know, I think many of these are good, like be solution focused and using data and things like that. But we've had very little opportunity to do anything geographically in terms of eastern part of the state or southwestern or whatever, and of building relationships. I think Lisha and Nicholas are able to build those relationships with outside partners, but we as a board really haven't dedicated the time to do that. So I don't think it's accurate at this point. I think our shared values, really, the values are there, but our ability to carry out aggressively a lot of the things outlined in this values document just isn't there.
I think you raised an excellent point, Ruth, in that, you know, is this designed to be aspirational? Is this designed to be, you know, these are the steps we're going to take to achieve the mission? And, you know, maybe getting a consensus on that would be helpful before I share my screen and we actually look at the values document.
Mm-hmm.
Does anyone have any thoughts about that? And this may come out when we actually look at the document. Okay, I'm going to pull it up and share my screen. Okay. So, thank you for your patience. Okay. Just moving all over a little bit. So, okay. So this is a nice, this is a preamble that Lois added. As you can see right here, the DCYF Oversight Board believes that shared values. So what I'd like people to do is actually just read this paragraph And I think at this stage, we don't need to get into wordsmithing, but really more focus on content. You know, is there any larger content or ideas that we would like to get in here or perhaps change? So that's what I would encourage you to do. So let's just all take a minute and read that paragraph, please.
Lisha, while everyone's reading, I just want to say why I added that to the document is because we did not have anything that it to just cohesively, excuse me, pull why we felt we needed the document together. So this is what I came up with to share out with the group.
Thank you, Lois. Ruth, I see your hand.
Well, I just want to thank you very much for drafting this. I think it's really a good statement of why we need shared values. Thank you.
Wonderful.
Me too.
Great. Thanks, Bobby. Any other feedback overall on this preamble? Okay, I'm not seeing that many hands, and just gonna also look at the time. We're gonna be going till 12 here because we have 30 minutes allocated. So this is the next section, which is very similar to the old shared values document. So basically, these are being used to achieve the mission of the board and then board member relationships. So code of conduct and then interpersonal relationships. If anyone has feedback on that, just feel free to unmute.
I like how it sets it up and it organizes the document.
I do too. Lois, you have excellent organizational writing skills. I mentioned that in my email to her, but I very much appreciate it. So thank you. Okay, so now we're looking at achieving the mission of the board. And it's this section highlighted. And I would just, again, let's take maybe a good minute and a half and look at this and see if there's anything we'd like to change or update. Any feedback from people? It does stay true to the original document. So, which you all, in 2019, the founding members of the board, really thought through at their retreat. So not really very many, no surprises here is what I'm trying to say. So I'm going to move us on. Okay. To board relationships. And I'm going to see if I can get the comments in the screen. So the first under code of conduct and operations, we've already discussed using first names as board members, so no need to discuss that. But we can look at this next section, and I can make it a little bit smaller so we can see some of Lois's comments. And this one, they were made in a Google Doc, so designed to be discussed. Google Docs are perfect for collaborating, so just want to mention some of the rationale behind that. But why don't we take a moment just to look at this, maybe a good minute.
Yeah, and since if anyone has any questions about my comments or need clarity, just let me know. I think I was the only one who commented throughout the document, so, or Lisha, if you need any clarification, let me know.
Thank you, Lois.
I'm not even sure I understand what, what consultant groups mean either. I mean, irrespective of whether or not it's our place. I mean, we do have specific statutory mandate, if you will, that we're supposed to go out to the public and hear from them, but that's not going in and talking to consultants. Which is kind of weird. The rest of it's pretty straightforward.
Ruth, I also see your hand. Thanks, Bobby.
When the department was first launched, they did contract with a consultant group to help with the whole issue of culture change, and there was a significant amount of study done and recommendations made, and I think we were trying to make sure we tapped into that. So I think that's what it was directed at.
I see. Yeah, I see. Well, we're talking about culture again now, aren't we?
Yeah, yeah. And I'm not sure that aligning with consultant groups should be called out in our values document. You know, I think we historically have had access to stakeholder groups and to the department, and we haven't really had an issue with access. So I'm not sure it needs to be called out separately. But I do want to point out that we, for the past several years since the pandemic, have met almost exclusively online. So I'm not, the alternate board meeting in person locations, east and west side of the state, really isn't relevant, I don't think.
Yeah, I agree.
Thank you, Ruth. And Diane, I see your hand.
Well, I was going to say that as well, since we're mostly remote, I think that's kind of obsolete, the alternate board meetings in person. I think you could remove that, seek opportunities aligned with consultant groups. And then I was interested in knowing what people thought about the next bullet point where it, sort of talking about, and we talked a little bit about this on our retreat, speaking as somebody who talks a lot in these meetings, how do people feel do we need to make sure that we're checking in with people that maybe are not saying as much during a meeting? How do you people feel about that? And I would say I would take out use the take around and whatever that is, because that doesn't make any sense to me. I don't know if it makes sense to other people, but is there another way we could kind of mention trying to get everybody?
Would just use the first sentence, maybe. I mean, and that allows, whoever's chairing the meeting to think of their own, or whoever the chairs are, or, I think because stylistically, it might manifest itself different ways.
Okay, so possibly using just that first sentence and removing the one that follows. Do people feel good about that?
Yes.
Okay, great. So let's do that. And everything else, any other comments on this section?
Well, Lois has commented on the track board progress and seek clarity on specific tasks. I guess that's more, I don't know. I see it maybe now that we're going to try committees again, that that has some merit to it, but I don't know how it would when we're meeting as the whole.
Yeah, and that was pretty much my question too, is just I wasn't really sure about how we would be able to if we're going to start having a feedback loop so we can see unresolved issues that maybe like Vicky had said, she was going to come back to us on different things. So is that going to be in a formal document, as well as where we are in our work plan for the year and the things that we have set out to accomplish? And then how do we determine when we have resolved something, when we can take it off that our quote unquote to-do list?
I think these are all really excellent points. And when I saw that, it almost looked to me as a staff role, really tracking board progress and seeking clarity on specific tasks in combination with, thank you, Senator Christian, for joining. I appreciate it. I see that you need to go. And tracking on various things, and then also being more transparent in our tracking. As we look at our priorities for 2025, which we shared in January, and I do have lined up ready to go, but it just seems that, I could share the mechanism where I can say, this is in progress, this, this hasn't been started, this is done. I wonder if that would be useful, or if that's too in the weeds.
Well, if we really, that's why why I mentioned the idea of, since we're doing committees, we're going to come up with a work plan, and I assume that Ben will, at least on his, and then maybe more as we have little work groups, because that's also in aid of getting people to be more personally involved, having them have a sense of productivity, a contribution to the work of the Oversight Board, in addition to sitting through 4 hours worth of meetings on a given day, so kind of thing, which, as I mentioned before, we started, and then, stuff happened with COVID and everything, and it all kind of fell apart, but we're doing again. So therefore, I think we will have, we will have work plans. So we will have tasks that we are, going to, as a board, approve, because the board would approve what its subcommittees are doing. And then we should track that. That I think it makes more sense.
Thank you, Bobby. Ben, I see your hand is raised.
Yeah, I agree with you, Lisha, that it is really a staff issue, and your relationship or conversations with the co-chairs. It's almost something that we would expect staff and leadership of the Oversight Board to do. So why do we have to call it out in a values document? Is it possible to have co-chairs and staff and board members who have no interest in getting clarity or tracking what it is that we're supposed to do? I don't think it bears repetition in a values document myself. But if it does, I think it should be attributed to staff and dialogue with the co-chairs, and then dialogue in our meetings with the complete board.
Thank you. Diane.
I kind of agree with you, Ben, that is more in our mission. That is our mission. So I'm not sure that has to be in the values document. But I also wanted to just call out that bullet point, allow time specifically for those on the phone, because nobody's really on the phone in Zoom meetings. We can just maybe say, I don't know if you want to say be comfortable with silence, allow time, practice patience as its own bullet point, but just take out the phone part.
I think that's a great idea. Let me know if anyone disagrees.
This was a pre-Zoom document.
Yes. That was a great call, Diane. Okay, so it sounds like for track board progress and seek clarity on specific tasks, we don't need to necessarily. Oh, yes, Lois.
Well, I see. What do you guys think about, allowing time? And I know it says on the phone, but maybe it should say, even in our, well, that was just a good example, Lisha, that you saw, you were moving on and then you saw my hand and came back. So I'm just wondering, how can we word that? Even in Zoom, we need to be able to give each other time to unmute and be able to speak before we we move forward. So how can we say that and have that as part of our shared values to just give people space to be able to do those things? Everyone is not on the same level technically.
Isn't
Well,
that,
doesn't
that's
that go
great.
with the third, well, it's now the second bullet, because
Right.
this, oh, wait a minute, not, and it's not really second. I thought you were further, but where it says creative space, isn't that broad enough to incorporate that thought, Lois? By, or maybe saying by create, make sure to ensure they participate by by, for example, calling on individuals to check or showing, or that's where the patient's part could
Oh,
be.
so you're suggesting just moving that up underneath there.
Yeah,
Okay.
because
Yeah.
that's really what it's in aid of, right? Is the creative space where everyone participates.
Mm-hmm. Yeah. I like moving it up underneath.
Yeah.
I think we can let Elisha wordsmith that. You're going to come back with another document for us, right, Elisha?
I
I
absolutely
think we
am.
ought to think we ought to have another value in here that says avoid group editing, but or at least in groups larger than two.
I want to
agree.
second that, Bobby.
I agree. We got to stay away from wordsmithing. I support that. Okay. So just
That's fair.
looking at the time, before I go on to the next section, are we all, are people feeling comfortable with code of conduct and operations with the changes that we've made in track changes?
yes.
Okay. Thanks, Ruth. Okay. Next section, interpersonal relationships. So I'm going to let people have a moment to read this. And then Lois, you also had some thoughtful comments here as well.
I think be willing to leave P in Pacific Northwest nice at the door is snarky.
Second that motion.
I'll third that. I haven't noticed that people in the Pacific Northwest are unusually polite myself, but I would recommend.
No
removing
friend of
that.
mine.
Well, I want to say that that is not my comment. I just was.
No, that's
moving
my
through the
comment.
document. Oh, okay.
Yeah, it was in the previous one. Okay, so it sounds like we're going to remove that. People are feeling comfortable with that decision, so I'm going to strike that.
Lois, what's your comment pertaining to? Which one? I'm not sure what it's aligning to. Oh, not the feedback loop. This stuff. Is this a role?
Oh, yeah, I think Elisha and I had talked about that. And Elisha, you might be able to fill in a little bit more about what it means by the stakeholder engagement. And I just saw her email. We went through the RCW about our role around stakeholder engagement. And my concern is that for us to make sure that part about that work can become actionable based on our limitations, is that something I was trying to think of a different way to word this so that someone else from the outside reading this document won't think that if we hear from stakeholders and then defining who a stakeholder is, because if a community member is looking at, well, I'm a stakeholder, I have a stake in this work, so why can't you take action on what I'm sharing? So just for us to just be to look at that language and maybe, again, not wordsmithing, but think about how we can make it so it's very clear what we can and cannot do.
That's very helpful. Thank you.
Yeah, I would agree with that. And I think stakeholder engagement, at least in the statute, I think pertained to these public hearings that we were supposed to be doing, to go around and hear from the public, I think.
I would need to pull up the RCW again, which I was looking at last night. Is that, I mean, Lois, I actually put it in an email. I don't know if you can grab it, but yes, Ruth.
Well, I think it also relates, there are a number of existing stakeholder surveys and
yes,
you know, work that's done by the department and by consultants that are called out in the statute that we should review. And
I see.
That's also part of this.
Well, then it does need to be rephrased because because that doesn't say
the work of
that doesn't
other
say what
people
you
who,
just said.
Yeah, really looking at the work of the people who are working with stakeholder groups and making sure we're aware of what's coming out of that work to inform our recommendations.
Yeah, I was just looking that up too, Lois. It says the board must no less than twice per year convene stakeholder meetings to allow feedback to the board regarding contracting with the departmental use of local, state, private, and federal funds and other matters as related to carrying out the duties of the department.
Yeah, that's what
I think that
yeah.
I really think that that's a conversation that probably we need to really get into some point, because our stakeholder involvement has really changed. And we talked a little bit about this at the retreat since COVID. What we were doing pre-COVID is different than what we're doing now. But personally, with this bullet point, I think you could just be intentional about stakeholder engagement, period. Something very.
I do like your point about revisiting it, because it was a topic of conversation at the October retreat and defining who stakeholders are. And so I think that's worth another conversation. So I did make a note in the comments, but what I'm going to do is I'm going to just put right now, be intentional about stakeholder engagement and remove the rest.
Yeah.
So that's okay. Okay, I'm seeing heads nod.
I personally don't understand what moving boxes around means in that last
It's like,
one. Does anybody?
It's kind of like deck chairs on the Titanic is where I think it's going. You know, don't, you know, that metaphor, meaning, you know, the boat is sinking and we're moving chairs around them.
Yeah,
you know?
I don't think it's a helpful.
I don't need, it's another snark, frankly.
Yeah.
We're a snarky bunch at the beginning, apparently.
Okay, so I will be sure to take that out. And people feel comfortable with that kind of going. Okay,
yes.
Great. And then I see Pamela, your hand is raised.
Yeah, thank you, Lashes. So I hear the word retreat often through this. What is the retreat? I don't think I asked last time, but I'm like, well, you know, I think this is a perfect opportunity to ask what the retreat is and what you guys do.
Yeah, I think that's a really great question. So we had one retreat this past October where the majority of us were able to meet in person. And just very briefly, this was the first time the board was able to get together in quite some time, mostly because of COVID. But in your welcome packet that Nicholas sent, there are notes from the retreat, as well as the various activities that we did, like defining goals, making sure that they were SMART oriented. But if you don't have that email, because I know I send a lot of emails, we'd be happy to send that back out to you, and then also dialogue just a little bit more since you weren't there, because you can't get everything from the notes about what happened. How does that sound?
That sounds wonderful. Thank you. And I get lost with my emails as well, so they all get compacted, and I try to look through everyone's as much as I can, but again, I'm working with other people with my projects with DCYF, so it gets kind of a bit overwhelming on my end.
Absolutely, absolutely. And that email in particular, that orientation email, it contains a lot. So absolutely, we're happy to send it again to you, and discuss it as well. Anything else on this section? Interpersonal relationships.
I would just think, I mean, Elisha, I don't want to, like you said, we don't really want to wordsmith, but I think you could make some of these a little bit more concise. I'm thinking about that one about be open to learning and growth, and then it kind of goes on and on and on. I mean, I would encourage you to feel free to just make things a little bit, maybe more one sentence instead of many sentences.
Amen.
That's a love of mine. So making things more
Amen.
concise. So yes, I'm happy to do that. Anything else just content wise though? And again, I just want to say that you will have an opportunity to review. I'll make the changes and then send it back out to the board. So this is nothing is final. I just want to make sure we're through. Yep, we are through our sections. So any last comments about the shared values doc? Okay, well, thank you all for participating. I think it's going to be much stronger, and I look forward to making it a little bit more concise and getting it back out to all of you. So I'm going to stop sharing my screen. Okay. I'm looking, oh, Diane, do you want to introduce, or I can just go into the next item on the agenda? Okay, sounds good. So we're currently at 12:07, and I have a feeling we might be able to adjourn a little early, but I thought it would be helpful to have like a meeting debrief, basically setting aside time for additional discussion on today's meeting topics and to address any necessary follow-up items. I do want to let folks know that during our DCYF presentations, I was noting action items, and I know Nicholas will be reviewing the recording and also noting action items, and those will be in the minutes, but there's always other things. And then right now, are there items, if any, that you all would like to discuss, or things that weren't mentioned that you would think need follow-up? So this is just basically an open time to kind of reflect on today's board meeting.
I wouldn't mind hearing from some of you that haven't said anything yet. I'm just practicing my try and incorporate everybody's few voices here as well. What we used to do ways back is sometimes we would go around and just ask people for what their takeaways were from the meeting. So we could consider doing something like that just to hear from everybody.
I think that's a great idea.
I can go first. This is all new to me. My background is in education, though we do touch a lot of children as the work goes on. I do have 2 daughters who have worked extensively in the Indian child welfare. And so of course I have all these questions for them, and they are not answering me. Just, what do you know is happening with, I can't remember what I wrote down. So a lot of this is new to me. And also I am in my learning, I often look for my own truths, though I respect each and every one of you. I will want to see how I interpret it, but I do enjoy listening to people. I do enjoy their points of view. And so just know that even though I may not speak a lot, because you really don't want to get me speaking, because then I never shut up. But I really do enjoy sitting back. And if there is, anything that needs to be done, and I feel that I really need to speak up, then I will. But right now I'm kind of just sitting back and taking in all the information you're giving me. You know, I've worked with a lot of children who have been in foster care, who have attended those juvenile rehabilitation centers. And so, you know, every story that you guys are telling, I'm thinking of those kids I've worked with, and how I can help will be, you know, being able to offer my points of view, maybe my concerns or even my questions, even my ideas of what that might look like or how it could be improved, or, you know, what other avenue we need to maybe go down to see what is possible. But really enjoying the group. Please don't kick me off the island because I'm so quiet, but I'm really enjoying my time here. I'm still new. There's a lot of things, which is funny because we were talking about, you guys were talking about acronyms in the arena of education. We have a million acronyms. And so I'm sitting there and it's so funny because I was reading through the thing and it's like, what does PNW mean? And I said, it can't mean the Pacific Northwest. And that's the only one I knew that it meant. So I was gonna something like personal net worth is what came up. And I'm like, you want us to put aside our personal net worth? Anyway, acronyms are fun. And I would appreciate, you know, like maybe what it means. I don't know if I'm just so far behind. The one you did about the junior rehabilitation to 25, I had no idea what that was, but my daughter did. So when I asked her, she just kind of shook her head. So, you know, I do a lot of research. That's why I kind of like the Zoom, because I'm over here on my computer looking at, you know, what you guys are talking about, the House bill. You know, again, I'm in education, so everything I do, but this does affect me because one of my important pieces in my work is those kids who are most vulnerable and those kids who are coming from families of poverty, those kids who are struggling with their own traumas at home that they're still experiencing from day to day. You know, I was thinking about all the different reporting that's done. And, you know, there's so many children who are living in this unreported, you know, so that even though we see the ones who are, you know, throwing up the flags and stuff, there's a lot out there that we don't see. And, you know, I think of a lot of people who are just growing up with that, you know, just making do with what the world has given them. So I appreciate everyone's work and just know that I am listening and enjoying every moment that I have. Thank you.
Thank you so much for sharing, Anna. And it makes me realize that we have an acronym list going, but it's always helpful to add to it. So yes, we won't capture everything, but at least it's a good start. Who else would like to go? Or just a takeaway from today's meeting?
I'll go. I'm not a person who runs off at the mouth. I tend to listen a lot. When I have a comment or a question, I will definitely raise my hand. I don't like to be called on. I was very appreciative of having people come from the department today and provide some current data. It was especially helpful to me to get information regarding early learning because that's not my area of expertise. But I am a data person, and so I really appreciated having data on Washington State. Because when I do my research, I tend to focus on national data points. And so those presentations were especially helpful to me. I do appreciate, as a new member of this board, knowing what the values are. However, for me, if we could shorten this document, that would be helpful.
I'm here to support that and help facilitate that. Yes, that sounds great. Thank you so much, Dr. Harris.
Sure.
I see Pamela's hand.
I think today was very informative, especially from Jenny and forget me if I'm wrong. Is it Vicky who had did the presentation? Okay, my memory's good today. So I like sometimes I do have questions on the spot, but there are times where I think about things a little, just to think about what I'm going to ask, and it might be well over like for example, I had a question that will be pertaining to Jenny if I can reach out to her through email about like some other collective data that I was just curious if they DCYF collects in regards to uh the child welfare system. And those questions didn't pop out on my head at the moment just because I'm busy listening to Jenny. And so I mean I love doing the work with everyone so far, and I think getting like data has just been insightful, and but also it kind of go like I don't know how to base this, but like there are times where I'm meeting people who are in the welfare system currently and with my app through my advocacy work, and sometimes I'm like, well, sometimes the data doesn't seem to align because of the population I'm surrounded with. And so that's why some of these questions I do have to bring up to Jenny is more so of like, is there follow up data after youth or young adults exit of the system? Is the exiting the system, is it just based off the ones who stayed in the system and not the ones that left and then ended up homeless? So I have tons of questions that I feel like would just eat up our time, but I would love to reach out to Jenny and Vicky or the other presenters one-on-one. And again, I am working on other presentations on projects and work, so that does eat up my time, and unfortunately I forget, but I do appreciate your weekly flat news flash and the recaps of what we did through our presentations, and I'm just really honored to working with everybody.
Thank you so much, Pamela. And I do want to let you know what we have traditionally done is DCYF has preferred having like one point person. So I'm happy to meet with you and kind of get your questions, help facilitate them, and then I would send them on your behalf. So that's what we've traditionally done, just so they don't have so many people. They don't have the oversight board, all the members, kind of interacting with them. I'm happy to be like a conduit, if that sounds good.
Yeah, no, that sounds amazing, and also that gives me more time to talk to you, so I love it.
Yes, win-win. Thank you for sharing. Ruth.
Well, I agree that the presentations were very valuable, and I was particularly struck and alarmed by the Family First Prevention, which Bobby and Ben DeHaan and I and Tana worked on, and Claire, and I mean, it just is incredible to me that I left the legislature 6 years ago and they were, really going into implementation, and it's still not implemented. So we talked at the retreat about a focus on child welfare. And I know I have been gone a lot and will be gone a fair amount in the next month and a half. But I just would like to revisit how are we going to have implement a subcommittee to look at child welfare. And the importance of a data system is very obvious, and the legislature's investment in data systems. So I'd like to talk to you about how to follow up on that.
Yeah, that sounds wonderful. And I think it is time to do that child welfare subcommittee now that we have two launched. So, and that was my takeaway as well, the $11 million on the table.
Yeah, it's just really tragic.
Yeah. Well, thank you for sharing. And yes, let's be in touch.
Yeah.
Anyone else like to share a takeaway? Diane.
Well, my takeaway is something that we really aren't given much of an opportunity to discuss because of the way we're set up. But I was really struck by the public comments, especially the written public comments today. There were some very articulate comments, and in particular one that was asking about getting stakeholder input. So I would like to see us circle back and kind of consider that, how we are going to get to the stakeholder input, because I think although I do believe that the DCYF presentations give us a very nice overview and give us the data, which is so important. I think it is important to also hear from the boots on the ground at times. And we do get some of that with public comment, but then we can't really have any dialogue in that setting. So I would really appreciate kind of thinking about that as a group, maybe at a subsequent meeting.
Sounds great. Thank you so much for sharing that. And it's on the action item list. Other folks, board members that have a key takeaway from today's meeting. Ben.
I'd like to go back to something that Ruth said that I think is critical to the overall functioning of the board. And that is that we historically have tended to rely heavily on presentations from the agency for good reason. But I don't feel that we have a solid pathway to follow up on many of these issues that are so very complicated. For example, I think it was the last board meeting, we had a presentation about the staff survey that I sent some feedback to Lisha, but every meeting that we have, there are reasons to actually get into further depth with the agency, and I'm not quite sure what the best way to do that is. I mean, for example, the data presentation today was very, very useful, but it has some big issues in it that should be discussed further. It's not the kind of thing that you want to do to a presenter to start nickel-diming them about individual charts and those sorts of things, because it goes to a very defensive place. So some sort of follow-up with some of the board members who are interested in it to get into more detail and more depth about some of these very important issues. The claiming issue for 4E, that is of critical importance. And I have some real concerns about it. I don't believe that we're going to have a CWIS system up and running in 3 years. I would bet you my wristwatch that's not going to happen. And so what we need to do is to figure out exactly what the plan is, because as each year goes by, there's more federal money left on the table at a time where we desperately need it. So rather than get into the specific issues, there seems to be some sort of structural pathway we need to create so we can get the right people to get into more depth on some of the issues they present, because it can't be done I don't think with the entire group. There's just not enough meeting time to do that.
That's a great point, and I think a great discussion topic for the group. Like, what would that pathway and follow-up pathway look like? Thank you for sharing that, Ben. I'm practicing my be comfortable with silence mode. But I also know that I stand between the meeting being adjourned as well. So I'm trying to balance.
Well, and I will just say that as the co-chair, since I don't want to call on people. I feel like we're all adults here in the room. So if people have things to say, they're gonna let us know. We also have the chat if people don't want to say something, if they don't feel like they can get something out. So I really appreciated Dr. Harris and Anna's comments about they're gonna put their input in when they have it. So I'm not somebody that's gonna go around the room and calling everybody for sure. All right, well, I think we could probably move towards adjournment. What is it? Anybody have anything else? I really appreciate the discussion that we've had today. Our next board meeting is going to be April 15th from 9 a.m. to 1 p.m. Subcommittees are going to continue to meet up until that time. And so we're going to continue to look forward to hearing from them. Hopefully my co-chair will be back in action. Oh, I see somebody's got their hand up. Oh, it's Lisha. Go.
So the next board meeting is May 15th. I apologize for that typo that you have.
I'm sorry, I had the wrong. May 15th.
Yes. Great, thank you.
Okay. Thank you, Lisha. Anything else, Lisha?
No, just thank you for everyone for contributing today. I thought it was a really productive meeting.
Yeah, that's great. Thanks, everyone. We will see you in May.
Thank you all. Bye-bye.
Thanks all.
Bye.